Now, we continue to shine the spotlight on people in the region who are helping others. And today, I introduce you to a dynamic duo who are helping people dealing with the ringing in the ear called tinnitus. Now, for some, it can be debilitating. But Patrick Lynch and Dr. Hannah Glick are providing help across the country. And together, they are this week's DMV Doers. As the CEO of ATA, talk about the work that your organization is doing.
So we're a national nonprofit based in the DC area, and we live to serve tinnitus patients nationwide. Believe it or not, there's about 50 million Americans that have this sensation of ringing or buzzing in their ears. I'm one of them. I started suffering from tinnitus when I developed cancer as a teenager. It's one of those weird conditions where unless you have it yourself, it's kind of hard to understand the impact. But if you do have it, you know pretty deeply how much it can affect your daily life. And so we're trying to make it better for everybody involved.
Programming, what impact does that have on ATA?
Yeah, so at ATA, I oversee all of the different programming initiatives that the organization does. So one of the biggest pieces of programming is support for individuals that are living with tinnitus. And one of the ways that we do that is through what we call TinApp, which is our helpline. We have skilled people on the other end of that helpline, many of which are healthcare providers that can pick up those calls and really help answer questions that a person suffering from tinnitus might have and help them get access to care, like our Tinnitus Today magazine, our Tinnitus Health newsletter. We do live webinars, podcasts, and we're about to launch a new initiative, which is ATA Academy, which is our online training for healthcare providers, helping them become better equipped to serve people living with tinnitus.
We have support groups across the country that we don't even run directly. We just try and help to facilitate and get them together and spread the word. And it's groups of people who also have the same condition, sitting together in a room, talking about what it's like for them to suffer through this thing, even though their loved one doesn't get it, or people think they're exaggerating. To be in a room together for an hour and a half of folks like you who are trying to survive this thing, that's something that the ATA provides that wouldn't be possible otherwise.
And for more on my interview with Patrick and Dr. Glick, head to our website, DC News Now streaming apps.